70-year-old Jerry who was working at Camp Oakwood stacking some canoes. Some chest pain brought him to his knees. Initially awake on our arrival, he started rapidly going into a VFib arrest. We gave him CPR and 2 stacked shocks, produced a pulse. 12-lead EKG en route shows a posterior MI. We were able to establish the line and start a lidocaine drip. Ready? 1, 2, 3. Patient's been unconscious since arrest. We started hypothermia protocol. We got wet towels and ice packs on him. Vital signs, his BP is 60, palpated. His heart rate 40 irregular. He is intubated and oxygen saturation is 97% by VBM for us. No history or allergies we're aware of.
Are you the daughter?
No, I'm his friend. I work with him at camp. Is he gonna be okay?
We're gonna do everything we can for him. His heart rate is too slow. We need to administer atropine to get his heart rate up. Okay, guys, looking at the monitor, he's in a code STEMI VFib post-arrest. Alert the cath lab and cardiology and get hypothermia protocol ready to go.
Junctional rhythm at 48 looks like some posterior and inferior damage in V1, 3, and V2.
Okay, the first thing we need to do is make it easier on his heart right now. If we thin his blood out some, it'll make it easier for his heart to function.
Let's get heparin going and start thinning his blood.
If we get his body temperature down far enough, we can get his brain to focus on the blood flow just on his core and not worry about pumping blood to his extremities. That should keep him alive. I want his temperature down to 92 degrees. Let's get him a cooling blanket. I'm going to get a central line in his chest.
Cath lab's ready.
All right, people, let's move.
What's happening?
They're going to take him to cardiology, to the cath lab. That's where they're going to really be able to help him the most.
She said something about a code STEMI and a VFib post-arrest. What does that mean?
STEMI stands for ST segment elevation myocardial infarction. A code STEMI is talking about how his heartbeat looks on the monitor. Basically, it means he's had a heart attack. VFib post-arrest means that his heart wasn't beating right. He's had a heart attack and now he's on the other side of it, but he still needs a lot of help.
Nicole, can you come with us?
Yeah.
Okay.
Thank you so much.
Good luck.
We need to determine what's wrong. It could be blockage, could be a coronary arterial spasm. Let's find out.
Inserting the cordis and sending the wire up the artery. Okay, and into Jerry's heart.
All right, we need to see how his blood is flowing through the heart to see where the problem areas are. I'm injecting some dye into the bloodstream that we can follow through Jerry's heart and hopefully find our blockage areas.
I see a vessel with blockage, Doctor.
Yes, I see it too, and it looks like there's 2 of them. We need to remove those blockages and get those blood vessels to remain open.
Should we perform an angioplasty?
Yes, we're going to insert a tiny balloon and blow the vessel back open, and then we'll insert a stent that will act as a brace to keep the vessel from closing.
Looks like Jerry might be okay.
Let's hope so.
Hey there, Jerry.
What happened?
Hi, Jerry. My name is Dr. Andrea Grayson. You suffered a myocardial infarction, or what you might know as a heart attack. When you felt that pain in your heart, it was because it was not getting enough oxygen, and your heart tissue was damaged. You had 2 blood vessels in your heart with blockages, and we were able to go in and repair those.
Well, Jerry, you're looking a lot better, and your heartbeat's back to normal.
Oh, thank you.
You're welcome.
You're going to have a few weeks in cardiac rehab, Jerry. You're also going to have to develop a healthier diet and practice regular exercise.
And you'll get plenty of that back at camp, Jerry.
I guess I'm pretty lucky, huh?
Yes, you are, Jerry, but you're going to be okay.
Thank you.
You're welcome.